all. Today we all are gathered virtually to attend the webinar on pediatric palliative care and approach to life-threatening conditions. Good morning, ma'am. Myself, Miss Roma Patel, Assistant Professor, Parul Institute of Nursing, Parul University, in Department of the Child Health Nursing. I introduce the madam's biography and the professions. So now let me introduce our guest speaker and their biography. So ma'am name is Alina Upadhyay ma'am. She is a pursuing PhD in Venkateshwar University, Gajrala District, Amroha, UP. Master of the Science Nursing in the Pediatric in the 2020, in 2010 she is a completed, and Bachelor of the Science is completed in the 2005 in Indore. Professional experience is St. Francis College of Nursing 2021 till Vice Principal come Professor. Index Nursing College Professor come HOD Pediatric Department 2010 to 2021. And last one is the Indore Nursing College Assistant Lecturer 2006 to 2008. And Maria Metta Hospital in Kerala 2005 to 2006. So ma'am have a good teaching experience and then the clinical experience also. So ma'am have service and leaderships also. So she is also former chairperson, board of the studies in the Marwan University, conference convener, member of the NAC, member of the IQAC's internal auditor, undergone the project of the nursing colleges and conducted the inspection of the many colleges and hospitals also. And she is conducting a workshop, seminars, CNA, and all other things related to the institution. She is also one good research guide, and then she is published many papers and books and another publications like national and international, and she's published in like Web Science and the Scopus Index journal. Ma'am have ma'am have a extracurricular activity like conducted training fashion in the different area in the hospital. She is a trainer also, and ma'am have a good experience in these training sessions. Ma'am have memberships also in the like TNI and Nursing Research Society also. So ma'am have a good experienced person in our in our educational side and then the hospital side also. So now, ma'am, I would like to welcome behalf of the Parul Institute of Nursing and Parul University. So now, without the delay, I request you, ma'am, start your sessions today.
Thank you, Roma, for introducing me and basically inviting me for this session. It's a great honor from Parul University, and I thank University regarding accept making me a presenter out of it. So today, my topic for the pediatric is basically pediatric palliative care, an approach to a life-threatening condition. Uh, we all have dealt with so many conditions. Roma, I'm audible to you.
Yes, ma'am, you are audible.
Okay. Can you change the slide?
Yes.
So today we'll be seeing these are the different objectives regarding my session. First is basically to know what basic pediatric palliative care, condition means, and we will learn about what are the benefits of having this palliative care, what is the setting for the palliative care, different principles determining this symptom that controls, and the challenges controlling the pain symptoms, and what basic team approaches are there for conducting or maintaining this palliative conditions for this pediatric patients. Next. Next session, please. So introducing regarding this pediatric palliative care, we all know that in a family, child is a very important part, and it is one of the basic family member that is an upbringing family member, And when they are the sufferers, and it is very difficult for the family to manage this type of uh, care. So basically, the meaning of this uh, palliative is from a Latin word, and it means it is derived from a pallier, that is basically meaning supportive aspect. So whenever we are introducing or making an intervention out of it, so we basically see there are three basic aspects in regards to this palliative care. First is basically to relieve the sufferings the patient have, slowing down their disease progressions when they are in a very distressed condition and in a life-threatening condition. Now, the third one is basically to improve their quality life stages, so that their life expectancy can be, their life expectancy's journey can be in a very smooth manner by relieving out their symptoms. So there are numerous studies they have that has been done regarding to this palliative care, and it was basically been seen that there's an improvement in the patient's quality of life, and this basically lowers down their symptomatic burdens what they have. So this have been a very good technique for a life expectancy journey what they are progressing, and this basically help them in a qualitative basically their life. So let me say what is basically a pediatric palliative care. When we look on to this, it is basically a family centered care, and it is basically been defined as a specialized medical care that is looking for the people living with a very serious illness. And WHO also have described, and it is a very good definition what they have given is, that is actively total care, active total care of that patients whose disease is not responsive to any curative treatment. This is a very good definition what they basically have given, that is the treatment has not been not been curative, but the expectancy of a qualitative care, that is basically a palliative. uh, Further we will see what is the difference between a hospice and palliative care. Next slide please. So we will see basically what is the goal in helping these children to live. That is, as well as possible, they have to, as well, they have to be, they have to be in the journey, and as long as possible, this have to be in the journey. Next slide, please. The basic aim of this palliative care is that is improving their qualitative life and relieving out their sufferings for these type of patients and advancing an advancement in their illness. So there is a component of this palliative care, that is you have to treat this children as a whole, and you have to look on to their whole of their aspect, whether it is physically, emotionally, or mentally, spiritually also. You have to deal as a whole person when you are treating with such type of patients. Next slide please. So I'm just putting on a question, and I want everybody to think out of it. That is, you just imagine that whenever we are facing such type of imminent death, maybe in the previous past days we have all met with these type of conditions, and it was very serious. And at that time, what basically we think about as a best bearer experience, we will see out of it, and you just think in your mind basically what experiences we will face when we approaches to such type of death. Next slide please. So it was seen, and it was basically been published in a national survey that is in the Journal of American Medical Association, and it was being seen that there was basically they have taken 340 samples who these children were seriously ill, and basic 9 attributes were given to them regarding to this quality life. to the end of their lives. And it was seen which basically which attribute they used to pick up. So this the first attribute the patient picked up was basically having this peace with God. And the second one was freedom from pain. This was the basic two most attributes the patients have picked up, and they wanted this basically at the when they are approaching to this end of life care. So basically they want these type of two categories. And second was one was very basic, and this was very true, that pain is the biggest enemy of a human being, and it is very necessary to alleviate the pain, so that person would have a comfortable journey when they have this life threatening disease conditions. Next. So we can see this is a basic what basically a palliative and hospice care is. At the mid core, you can see that there is a hospice care. That is, hospice care basically is when you are approaching to a end care of journey, and a circle or a core or an aura is being made to an end of life care. You have to be basically approaching with this palliative care, because palliative care basically is treating those signs and symptoms what basically they have in this life threatening conditions. And it is very much necessary when you reduce out or care for these type of symptoms, so the patient basically approaches to their end stage very calmly and quietly. And children basically they doesn't have that much understanding at any age groups, because their understanding as comparative to the adults are very lower, and they have to be treated in a very calm manner and very comforting manner, so that they would bear with this condition in a very easy way. Next, I'm not able to see the slide quickly. Roma, can you share the slide? Hello. Roma, I'm audible to you? Roma, can you share the slide, please?
Ma'am, voice is not audible.
No, your voice is not at all audible. I'm not able to see the slide also.
Now is okay, ma'am?
No, I think you have put on the video, because of that the slides are not being shared, I think.
Hello.
Yeah, Roma.
It's visible, ma'am?
Yeah,
Okay, ma'am. Now you can start it.
at the back, please. Can you again? No, you are forwarding it. I mean,
It's in. internet problem.
Okay, next slide. So basically, we will see this. There are the census of this palliative care. You can see that is 4 million children with oncological diseases worldwide. If I'm saying, they require basically the pediatric palliative care. And India, it was been estimated that 1.6 million children they need these type of specialized pediatric palliative care. And now it has been recommended by the WHO that those hospitals who are treating with this oncological patients, they basically have to provide such type of care to the patients. It has been recommended by the WHO. So when you see about the persistent pain experienced by the children, you can see 80% of the children they have the cancer. 67 children have non-malignant diseases, and 55 children they have been with this HIV and AIDS. Next. So this is an age group percentage. What we can see or observe is 1 year below to the blue indicates, light blue indicates that is 41 percentage of the younger children and 1 year children, they are being sufferers for these type of patients. 2 to 17 years, 45 percentage they are the sufferers, and over the 18 years, that is 13.4 percentage people are basically the sufferers for this palliative. Next slide. Next slide, please.
Hello.
Roma, slide is not being, visible.
Hello.
Hello.
Ma'am, my voice is audible.
Sometimes it is audible, sometimes it is not audible. I mean, it was audible just yet. Hello. Can you share that slide? Roma, I'm audible to you? Hello. Hello.